Aloha, I'm Lyla Berg. Mahalo for tuning in to Island Focus. We're still broadcasting this program remotely from my home as Hawaii reopens so that you can meet the people who influence our daily lives. Thank you for joining us on Island Focus. With us today on Island Focus, I have the pleasure of talking with Dr. Mark Mugiishi, who is the CEO of HMSA. Aloha, Mark. Thank you for joining us.
Well, thank you so much for having me on the show.
To say that you are busy is an understatement. Please help us understand what HMSA is also experiencing, and as we reopen Hawaii incrementally, what are some of the considerations from the human side?
Clearly, we're a health organization, so the health of our members is our purpose for existing. During a pandemic, obviously, it's always important, but it becomes all the more emphasized during a pandemic. So we've been very interested in making sure that the health and well-being of our membership is well taken care of. The interesting thing, though, from the human side to understand is there are two components to that health issue. One is the immediate impacts of a infectious disease like the SARS-CoV-2 virus causing this pandemic. That's one thing, and we obviously don't want a lot of people to get infected and very sick and hospitalized from that. But there's also the health impacts of if we get impacted for too long a time as a community, as a society, economically, socially, and all these other ways, it actually impacts the public health of future generations. And during pandemics and other big economic calamities, it's the adolescents and the young adults who get impacted the worst, and it gives them a generation of bad health. And so we will create a Hawaii that's not good for our children over a long period of time if we're not careful on that end as well.
Can you speak a little bit more about that and what, not only the implications, but what might we do to mitigate that?
Yeah, so I think it's a big balance, right? It's understanding that to control the infectiousness of the virus today, we need to take good social responsibility by making sure we socially distance, making sure we stay at home when we're sick, proper hygiene, wear a mask, all of those things that we hear over and over again. We need to do all of those things. But we also need to make a concerted effort to do all those things so we can control the virus, so we can get back to some of the things that will make sure that our society kind of acts and behaves as it has in the past, where, we're able to go to school and go to the park together and enjoy our beaches and things like that, which will be very, very important for the next generation and our own generation, actually.
Yes, and the way in which we carry out those tasks. There's some folks are resentful of having to wear masks, and there's fear generates anger. All of those emotions are hovering underneath the surface, and I'm sure they're felt by employers, employees, children.
Yeah, no, absolutely. I mean, it's a scary time. Let's just face it. I mean, no matter how you cut it, being in such a disruptive generational pandemic like this is scary. It's disruptive. And so it has affected the way people view the world. It has affected the way they control their emotions. We've seen a big uptick in behavioral health. So one interesting thing that we've seen is that because people struggled to get to the doctor during this pandemic, the amount of telehealth that is used has gone up 10, 20 times. So people get online to try and see providers. And the biggest uptick has been in behavioral health, where people are seeking assistance in mental health issues.
That's a good sign, though, because people
It is a good sign that they're looking for it. It's not a good sign that it's happening.
Right.
It's a good sign that they're seeking help for it.
So if people are paying attention to themselves and their families and asking for help, how is HMSA responding besides the telehealth? What recommendations can you give the rest of us in the community to support that?
Yeah, so, HMSA, we have a lot of stakeholders, which has kind of positioned us in a unique position where we can reach out and try and help a lot of different segments. Obviously, we have our own members who they're the core of our mission. It's, to improve the health of Hawaii. So we need to pay attention to our members. We also have our providers who are the caretakers who are out there actually delivering care to our members. We have our employer groups, who are the businesses that are paying for this care. We have the government, that's our partners. We have the communities where everyone's living. And then we have our own employees, right? So we have, nearly 2,000 employees who are out there helping, but they have their own problems. And so we get kind of a firsthand account of the issues that the people are having by looking at our own employees. It's what am I going to do about coming back to work when my kids can't go to school and I have to watch them? How can I make sure when I come to work I'm safe and I'm properly distanced from my other employees? Things like that. So those are the kinds of the things that we are trying to help people work through as they try and get back to normalcy in their lives.
Well, in my experience with HMSA, and perhaps it can be part of your closing, the care that we give to each other and that concern and the sincerity of our aloha really makes a difference.
This pandemic, COVID-19, it's unprecedented. There's been nothing like it. To overcome something that has this much impact on our community, it has to involve the entire state, all of us coming together. And I think part of the reason why Hawaii has done so well compared to many other states across the rest of the United States is that we do have that spirit of ohana, that community spirit, that that ability to come together and care about ourselves, each other, our neighbors, our family. That spirit has helped us get through this. I know we still have work to do about making sure everybody wears a mask, everybody respects social distancing. But when you look at what we do here compared to some, what you see on social media is happening in other states like Florida and Southern California, we're pretty good. And so we can keep getting better, but I'm proud of the way Hawaii has responded.
Well, thank you very much for taking the time, and thank you for working with all of us and representing HMSA in such an honorable way. Thank you.
Thank you so much, Lyla.
You've just had the opportunity to listen to my conversation with Dr. Mark Mugiishi, who's the CEO of HMSA. Mahalo. Today on Island Focus, you will enjoy meeting Dr. Sumner Croix, who's a research fellow with the University of Hawaii Economic Research Organization. Appreciate you being with us today, Sumner. Please explain to us a little more what your role is as research fellow and what UHERO is at the university and what it provides.
I'm a retired professor from the University of Hawaii Economics Department. I retired about 3 years ago. And since then, I've been working with UHERO on a variety of economic projects that affect the Hawaii economy. In some cases, I put together interdisciplinary teams of people. For COVID-19, this is one of those cases. I've been working with a public health expert from the East-West Center, Tim Brown, who's an expert in looking at AIDS epidemics. And I've also been working with Dr. DeWolf Miller, who's a retired professor of epidemiology at the Japson School of Medicine. And so the three of us looking at COVID, I think it's a unique perspective, because we have an economist who's looking more at human behavioral issues. We have a public health expert who's skilled at looking at people's responses to epidemics. We have somebody who's really looking carefully at the data from the epidemic. This has been really fun working with an interdisciplinary team. I think it's also helped inform our research a lot.
So based on the research that you've been doing and also that UHERO has been involved in, where are we now?
We're in a perilous place because 1/4 of the economy is shut down. That's the tourism sector. The tourism sector is responsible for 17% of the direct output in the Hawaii economy. There's another about 8% that's the spillovers from the tourism sector. So that's 1/4 of the economy is not operating. If that continues, there's only just one word for what we'll have here. That's a depression. Right now, we've been supported by federal aid that's brought in unemployment funds and loans to small businesses. And that's kept us afloat. The decline in income hasn't been as big as the decline in output. But as that federal aid dries up, we're going to be in deep trouble unless we can get the tourism economy restarted.
So in addition to the tourism economy, there is a trajectory up. We can get out of this.
Oh, I think there is, yes. I mean, there's also other parts of the local economy that need to be restarted.
And it's the people that are involved, right? And the well-being, not just the safety, but their preparation to go back to work.
So what's happening is as we started to reopen, we turned out to be much like some other places in the United States, is that the epidemic resurged. We thought we had the epidemic under control at the end of May. We were getting just 0, 1, 2 cases a day. We were all patting ourselves on the back too, and I think rightly so. And then what happened is, as we reopened, people let their guard down a bit. They paid less attention to certain behavioral metrics, to certain measures of behavior that they should have paid more attention to. And now we've seen a spike in new cases. So that as people are going back to work, they're left with really a feeling of nervousness, and they're not quite sure what to do in the workplace because of the epidemic resurging in Hawaii.
And what you said very clearly is we need to pay attention.
What's really critical in opening tourism is that people working in the tourism industry and the general public both believe that when tourists come here, it's going to be a safe operation, that most of the tourists coming here are relatively free of COVID. You can never say for sure about these things, but that we make efforts to basically try to screen out people who are actively infected with COVID. Tourists, when they come here, need to be saying, one of my prime goals when I come here is to have a good time. And the second goal of equal importance is to make sure that I haven't contributed to worsening the COVID epidemic in Hawaii.
So let's broaden the conversation from tourism, because that's
Okay.
one aspect of the economy. We also have our local agriculture, our small businesses. Help us understand the considerations we need to have regarding people's well-being and people's psychological, I guess, preparation to go back to work.
I look at the episode that happened at Hawaiian Air the other day, where a training held here in Hawaii, where people came in from all over the country, ended up with over 40 people being infected with COVID. And, you know, I look back and I wonder, what we've heard about that episode is that people started off using masks, and then as time went on, they basically removed the masks. People started off social distancing, but they stopped social distancing. Hawaiian Air made a lot of efforts at the beginning to keep the areas really clean where they were training. Later, that kind of slacked off a bit. You know, I look at an episode like that, and I think it's really instructive. And it's instructive because Hawaiian Air is a really good corporation, from my point of view. It's a responsible corporation. It does good work in the community, provides good air service. I know we're all cynical about the airlines, but it's a pretty good airline, okay? And it's a good corporation. And yet, their management really failed in this regard.
What can we learn in terms of calming the waters so that when people do go back to work and we recover our economy in whatever it will look like?
People need to be aware that others are listening to them. You know, they need to be aware that if they speak up and say, I don't think what's going on in my classroom is safe, that others are listening to them, that a school principal is saying, okay, we'll look at that. We'll pay attention. This is an environment where we have to be flexible. We have to listen to people. We have to take into account people's concerns because they're in very different situations.
What I actually hear you saying is the importance of communication. Even the innuendos and the body language of employees as they come in, not whether they have a fever or a cough, but rather how are they navigating their own anxieties?
You know, I think we have all the ingredients in place here to get the epidemic under control. A lot of it, though, is that there does need to be really good messaging on the part of everybody. You know, if we're talking about parents talking with their children, there needs to be good messaging. You know, they need to be really aware of what's happening. And the problem is those messages are going to change. What is reasonable today might not be reasonable tomorrow. You know, tomorrow we may be able to relax a bit, or tomorrow we may have to tighten up a bit on various restrictions. And this is a hard message to get across. In some sense, it's almost easier just to say, do this. And in this case, what we're left with is, please pay attention because it's going to be changing over time. The good news is if we do pay attention, I'm really optimistic that Hawaii will get its epidemic under control.
Thank you, too, for tuning in to Island Focus and my conversation with Dr. Sumner Croix, who is a research fellow with the University of Hawaii Economic Research Organization. Aloha. I'm here today on Island Focus with Judith Clark, who is the Executive Director with the Hawaii Youth Services Network. Thank you for joining us, Judith.
I'm delighted to be here.
Like most organizational leaders, you have your hands full. Can you explain a little bit more what the HYSN does and maybe how we can support the efforts of all your organizations.
Well, Hawaii Youth Services Network is a statewide coalition of youth-serving organizations and a Pacific Islands training center. We ourselves generally do not work directly with youth. Our audience is the youth workers and the youth agencies. We help youth agencies develop partnerships and collaborations. We do needs assessment, planning, and public policy development. And we've found that since COVID came, we have been busier than ever because a lot of our work in recent months has been focused around COVID response.
So the role of social services and nonprofits, particularly relating to the needs of youth, are critical at this time of recovery. Can you speak a little bit more about that?
Nonprofit youth agencies have had to very quickly pivot and find new and creative ways to continue to provide services and to provide services that meet new and emerging needs. Nonprofits are effectively small businesses that support our economy. We account for about 12% of total jobs in Hawaii. So if we want to improve our economy while at the same time preserving the critical safety net of services for our children and youth, we need to sustain the funding for nonprofits. We can respond much more quickly to changes than government agencies do. And that's going to be critical with the short time period that we have to spend the Federal CARES Act funds and other resources for COVID response and recovery.
And the ability to respond so quickly actually is so critical with our children and youth.
Yes, I mean, their lives have been turned upside down in a moment. You know, everything that they could count on, going to school in the morning, playing with their friends, going to the beach, all of this has changed. And every decision they make, they have to consider the risks to themselves, to their families, to their kupuna.
But what are our children experiencing now, and how are the organizations helping with that?
They're experiencing a lot of trauma. Without any warning, suddenly their schools closed down. They weren't able to socialize with their friends. For smaller children particularly, they worry that, they don't have the sense of proportion. They worry that, what if everybody I know gets COVID and they die? What if I get COVID? I have a friend with a 2-year-old. When COVID came, he had to stop going to preschool. Mm-hmm. He's old enough to miss his friends. He's old enough to miss visiting his grandma, but he's not old enough to understand why this is happening.
Any last thoughts that you'd like to share with the audience, Judith?
Well, we're looking for youth to help us plan and put on the Children and Youth Summit this year. If you would be interested in serving on the planning committee, becoming a speaker at the summit, or facilitating one of the breakout groups, please contact Kira Thompson on our staff. That's Kira at hysn.org.
Thank you so much. We're going to look forward to our youth contributing in very substantive ways in the future. Thank you for joining us, Judith.
Thank you. We need a youth voice in planning during this time. Thank you for this opportunity.
You've just had the opportunity to meet Judith Clark, who's the Executive Director for the Hawaii Youth Services Network. Mahalo for joining us. Mahalo for tuning into Island Focus and joining me in getting to know a little better, Corey Rosenlee, who is the president of the Hawaii State Teachers Association. Good to see you, Corey. Thank you for joining us.
Thank you, Lyla. Good to see you.
So, schools reopening or not opening, teachers going back or not going back, there's a bigger conversation here at the moment. Can you share with us what that conversation is, the considerations, and maybe some of the lessons learned from other countries as we are deciding what to do with our schools and our children?
Everyone wants our keiki back in our schools. no more than our teachers do. But the big question is, how can we make sure that if we bring our keiki back, that we keep the health and safety of our keiki and our teachers and our staff in the front of our minds? And what we've seen is, we've seen schools across the world that have tried to open in countries, and when practice has not been followed, they have to close right back down. In the countries that have been the most successful, what they've seen is it's not about opening the schools, it's how a community comes together in order to make sure that if our keiki are the priority, then it's our daily responsibility. How we intermingle, are we wearing our masks? Are we maintaining our social distancing? Because that's what it takes. And I think that when everyone sees it, that it's all of our kuleana to make sure that our keiki learn, then it's something that we do on a daily basis.
I appreciate hearing that, because there's so much conversation about the protocols, and the details of 6 feet or 3 feet or 10 feet. Maybe you could give us a snapshot of what a school day looks like from the time the child gets up till he goes home, so we have a better memory of what we're talking about at schools.
One of the things that Dr. Park has been arguing for, our state's epidemiologist, is that there's this idea of an Ohana bubble. And I can tell you from the practical level of a school that that's not going to happen. So, our students, let's just take an elementary student. They come from their home, that's one Ohana bubble. Then they go and wait for the bus, that's one Ohana bubble. Then they get on the bus, that's another Ohana bubble. And then they get to school and they start playing with their friends, and that's another bubble. Then they get to the classroom, and that's all that Dr. Park is thinking about, is that one Ohana bubble. But then if they go use the restroom, another Ohana bubble, then they start playing with their friends or go to A+ after school. And again, by the time you look at it, you could potentially be exposing yourself to over 100 people. At the secondary level, I'll tell you, I am a veteran teacher of 20 years, and I will tell you, the kids have no idea what social distancing is in between periods. And I'm even concerned that they're going to take off their masks in between periods, because at Campbell, my high school, they're supposed to wear a T-shirt with Campbell on it. And the second class is done. All the kids are taking off their shirts, because they don't feel that it's the same thing. And what we've seen in the entire country is that young adults think they're impervious to the virus, and they're not. We just know through brain science sometimes that our young adults are not thinking of the long-term consequences. And so that's something that we have to think about.
So there's so many aspects of going back to school and so many people involved. As we move toward the end of our conversation today, what are some of your recommendations on how we can support you, the teachers, our children?
I'll tell you something that was disheartening. When Dr. Bruce Anderson was asked about the risk of opening our schools, he said there's low risk for kids, but that doesn't take into mind our teachers. And I'll tell you that as teachers, that was painful. Our teachers want to be in schools, but we don't want to be made feel guilty that we care about our health and our family's health. So I think that we all have to understand that in order to open our schools, everyone has to do this together. We have to take into consideration our keiki and our teachers and our staff. Mm-hmm. Some of them are older, some of them have underlying conditions, and we should not discount them because they have these concerns.
And staff meaning clerical, custodian, cafeteria workers.
We have our educational assistants. We have our principals. Our custodians have been heroes. Our lunch workers have been heroes. They've been trying to deliver lunch to our keiki during this pandemic. Our custodians have done an unbelievable job. And so, we really have to see the great work that everyone is trying to do. And our teachers, I want to say this too. In order to do distance learning, most teachers have shared with me, and we've polled on them, have had to do more work than they've ever had to do before, because they have to plan 2 lessons at the exact same time and do it completely from scratch. So, everyone is really going out there to try to make sure that this can happen.
Well, and I would imagine that as you talk about the community, also the resources for educational experiences, we're going to have to really change the way we look at, quote, education.
And unfortunately, we're asking people to do more with less, and sometimes with less means not at all. Just yesterday, the Board of Education was trying to cut pay for special education, HARDA staff, and Hawaiian immersion teachers, even though those are the areas that are most hit by, the pandemic. And so, you know, if we don't have the equipment, it's very difficult to be able to do our jobs.
So you speak about the community coming together to help figure this situation out about education. What can we really do?
Well, I think one of the things that I think our teachers are looking for is empathy. You know, we have to understand that, again, that our teachers, some of them can be older, some of them have underlying health conditions. You know, a lot of our teachers take care of their family, even their elderly parents, grandparents, and we love our kids. I mean, there's a reason why we call them our kids, is because there's a reason why we can teach them. We love working with kids and helping them learn. And so we're being put into this position where some people have said we don't have courage or we don't care if we're not willing to risk our health and our lives in order to go back to school. And I think what we're trying to say is, of course we love our kids, but I'll tell you, not one teacher would want the guilt on their conscience that if we opened our schools too quickly and one of their students got sick and they felt like they could have done more, I mean, that's a long-term consequence that none of us want. So we want to do this very carefully, make sure that all the processes are in place. And then I think everyone has to ask, if we still see cases rising, is it safe? You know, a few months of delay is not worth a child's life.
So one parting message as we wrap up our conversation today.
I want to say to everyone that I think through this pandemic, we've realized how important our schools are, important our teachers are. And I wish that it wouldn't take a pandemic for us to realize this. And I think it's something that we've got to think about even when this pandemic is over, is how do we make sure we support our schools to make sure we can give our keiki the best education possible.
And perhaps do it in even multiply creative ways.
Yes.
Thank you so much for joining us and for taking the time, Corey. I look forward to finding out what's going to happen next. Thank you.
Thank you, Lyla. Good to see you.
You've just had an opportunity to meet Corey Rosenlee, who is the president of the Hawaii State Teachers Association. Mahalo. Mahalo for being with us on Island Focus. I'm Lyla Berg. Our crew and the staff at Ōlelo Community Media wish you well. Aloha and malama pono. Let's take care of each other. See you soon.